Hello guys, today I'm going to talk about, or I'm going to focus on one of the complications of diabetes. A lot of people know about the sugar, the kidney, the weight, the insulin, but one of the very dire complications is the diabetic foot ulcers or the foot problems resulting from diabetes. Over 80% of people that require amputation, we notice that they are preceded by foot ulcers. Now, broadly, foot diseases in diabetes are classified into two. One is the peripheral neuropathy, that is, the nerves that supply the skin and the superficial muscles have been affected by diabetes. Watch my earlier video. Because of that, the person cannot feel sensation as well as before, or is gradually reducing. This person will have trauma, that is, will hit his foot, there'll be a problem, there'll be a wound, the person will not notice on time. The other one is, we call it peripheral vascular disease. As a result of diabetes too, the blood vessels that supply the feet will be damaged and be narrowing and be reducing. So blood supply will be reduced, skin will be damaged, skin will get broken, ulcer will form, bacteria will get in, antibodies will not get there, ulcer progresses, and then the person may require amputation. And we notice that the most common cause of non-traumatic amputation is diabetes. So apart from accidents or one disease, one hazard somewhere, diabetes. And after amputation, there's a 70% mortality rate after 5 years. I will not explain that one because it's not for the scope, but let's leave it like that. What do I do to prevent myself from having diabetes or diabetic foot ulcer? Number one, make sure that my sugar is maintained. So if it's your dad, your grandfather, your grandmom, your elderly person, your mom, make sure that the sugar is controlled. Number two, foot care. So if you are checking your own foot, every day you must look at your foot. What are you looking for? You're looking for cracks, you're looking for calluses, that is hardening of the skin. You are noticing numbness. You're touching one part, you're not feeling as much sensation as before. You're noticing break in the skin. You're noticing swelling. You're noticing that maybe the hair on one part of the body is not growing, or there's no hair like before or like the other side. You're noticing that there's tingling or pain. You're noticing sudden hot, prickly, or numb sensation. You're looking at your footwear. Your shoes should not be oversized. If you wear fitting, and should be protective. Your soles should also be protective, not too tight. If you are such that you cannot bend and look under your foot, or you cannot pull your leg up, use a mirror to check. You're checking for change in color. You're checking for creases. You're checking for breaks in your skin. And if you notice anything that's out of place, quickly contact your doctor. The doctor will look at the color, you look at the shape. Is there any deformity in the leg? Is there any hair loss? Is there any pain? Is there any tingling? Is there numbness? We'll use a monofilament to check. Is there ulcer already? Is there a callus? Is the person sweating on that leg or excessively? Has the hair gone? We examine all this to assess, okay, is it severe? Is it low risk? Is it high risk? If it's low risk, that is only callus is formed, we'll say, okay, keep your sugar monitoring, come back every year for your checkup. If it's medium risk, that is there's callus formation, there's break, there's something we are checking, okay, 3 to 6 months to monitor. And of course, you are looking at your hygiene. So every day you must wash between your toes, wash, or people are going to meet a bookie to help you check your nails and verruca removal and pedicure. You have to be careful. If there's a wound or a sore there, make sure that you remove it and you treat it properly. We notice it more in people that have had previous amputations, previous ulcers, people that are over the age of 70, of course, it can occur lower. People that have neuropathy, because neuropathy and peripheral vascular disease can occur together. People that have had DM or diabetes for a long period, maybe from childhood, especially uncontrolled diabetes, they are more at risk. What do you do? Once you notice all those things, go and see your doctor. They'll give you a schedule. There is usually multidisciplinary, that is, skin doctor will see you, your kidney doctor will see you, your endocrine doctor, your hormone doctor will see you, your heart doctor will see you, the person that takes care of your heart and blood vessels will see you also. They all work together to make sure that every part is getting its own care. So please make sure you check for your parents, for yourself, for your siblings, for your elderly ones, and see the doctor as soon as possible. it is another level of depressing to have a limb to be cut off. So don't let your loved one, don't let yourself get to that level. I'll see you guys at the next one. Bye-bye.